This presentation is for educational purposes only and should not be used to diagnose or treat any medical condition. Please speak with your healthcare provider for personalized guidance.
Dealing with depression in family practice. When a patient is diagnosed with depression, your family doctor is well trained to provide care, ranging from prescribing antidepressants to helping find other resources. Hello, it's Dr. Raquel once more, and I want to welcome you to another installment in the Patient Education Library Initiative from the family practice of Dr. Ralph Aziz. Today, we will be looking at the role of your family doctor in managing depression. Of course, the first thing that may come to your mind on hearing the word depression is a psychiatrist. But your family physician is really the most important initial point of care for you. Depression is always a complicated and contentious topic. So before we embark on this journey, I would like to state that this presentation is for educational purposes only and should not be used to diagnose or treat any medical condition. Please speak with your healthcare provider for personalized guidance. Depression is a medical illness that affects people of all ages. It can make it hard for people to take care of themselves or function at work or school. It can even be dangerous, leading to self-harm or thoughts of suicide. Fortunately, depression can be treated. As a family doctor, I'm trained to care for patients who have depression and help them find useful resources and support. Recently, a 19-year-old woman, who we will refer to by the fictitious name Megan, came into my office for a visit. She had been feeling sad and down throughout the past year. The problem wasn't just feeling a little blue sometimes. Megan hadn't been eating well and had lost weight. Things she used to enjoy, like going to movies with friends and playing volleyball, didn't seem interesting anymore. She was having trouble paying attention in class, and she just couldn't get motivated to do her homework. As a result, her grades had dropped. Megan told me she felt a little embarrassed to be admitting out loud that she was struggling. Like many people, she had a hard time explaining exactly what she was feeling. She took several long pauses, but I was careful not to interrupt. Megan told me that she was feeling both sad and anxious at the same time. "I feel like I'm coming out of my skin," she said. Although she felt tired all the time, she couldn't fall asleep at night. She would often toss and turn for hours, usually thinking about past mistakes. At times, she would awaken suddenly at 3 a.m. for no reason. Sometimes, she wished she could just disappear. Fortunately, she had not thought about hurting or killing herself. As Megan talked, I noticed her body language and speech patterns. She fidgeted with her hands a lot, and she looked mostly at the floor. I asked some questions to make sure she was safe and to rule out other things that can make depression worse. Megan said that she was not using drugs or alcohol or engaging in high-risk sexual practices. She said that she felt safe at home and elsewhere, but she wasn't comfortable talking about her feelings with her parents. I thanked her for having the courage to come in and ask for help. She admitted it had been hard for her. I let Megan know that it's common for depression and anxiety to go hand in hand. I explained that they don't just cause psychological symptoms. They can also affect you physically and cause symptoms like chest tightness, fatigue, headaches, and jitteriness. Since I could tell that Megan held a lot of her feelings in her body, I recommended taking a few minutes each day to put on music and dance. Dancing is a great activity to help relieve tension and improve your mood. I also taught Megan a relaxation technique to use whenever she was feeling anxious. It's a simple, effective exercise called soft belly breathing. It involves breathing slowly in through your nose and feeling your belly fill with air before breathing out through your mouth. In addition to counseling, I prescribed a low dose of an antidepressant for Megan. I explained to Megan that it can take several weeks for an antidepressant to start working. Side effects from these medicines usually decrease after a couple of weeks. When a person starts taking medicine to treat depression, there is a risk of increased suicidal thoughts, particularly in young people. Although this is rare, I discussed the risk with Megan and made sure she had a plan just in case. She already knew about suicide hotlines that are accessible by phone. She also identified a friend to call if she had thoughts about hurting herself. I assured her that she could always call her counselor or my office, or go to an emergency room if she needed help right away. I asked Megan to come back for a follow-up visit in 1 week so I could see how she was tolerating the antidepressant. She told me it was a relief to talk about her feelings. She felt hopeful that her symptoms would improve over time. As Megan's family doctor, I'll continue to guide her treatment for depression and provide needed care and support. There is a take-home message here. Get help right away. There are people who can help you. Depression can be successfully treated. I've tried to navigate this topic through the use of an example in real life. While there are clear and definite reasons to see a psychiatrist, it is generally better to see your GP first. There are other advantages to this route, such as mitigating the significantly higher cost of seeing a specialist and lengthy appointment waits. Also, your GP knows your history and is generally more accessible. Remember, too, that some medical conditions like hypothyroidism and autoimmune disease may present as depression, so self-diagnosis is never a good idea. There's another matter. Many people feel that they are immune to depression and anxiety. They also don't understand that anyone can develop these problems, and it doesn't signify weakness. Letting your ego get in the way will only do you harm. That brings us to the conclusion of this video. Here's hoping that you were able to connect with my story and that it generates more trust and confidence in your family doctor. As I end this video, I wish to express thanks to Dr. Aziz for this opportunity to address you. And remember, your health. It's our priority.
Ready to take the next step in your health journey? Call us at 868-664-0531 or email us to book your appointment today, or book online at www.drralphaziz.com. Also, look us up on Instagram for health tips and updates. Your care starts with a conversation. We're here when you're ready.